All right, let's get it started. Woo! Here I am. Hey, everybody. Hello. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I've partnered with Better Spaces to bring you an easy and educational workday session. And you know what? Today, I'm going to be talking about understanding and managing tendonitis in athletes. Now, does it mean like you need to be an Olympic athlete or play a sport? You know what? No. Everyone is an athlete. And that's my philosophy. Whether or not you are running a marathon or playing a sport or just getting up out of the couch and walking your dog, right? Everybody's a human being, and all of these principles that we're going to be talking about are all applicable to everybody, all right? So in the next 20, 30 minutes, we're going to be talking about how to understand what tendonitis is, how to manage it, and we'll talk about the causes, particularly in sports and overuse injuries, and also treatment options and preventative measures. Now, a little bit about me. I got my doctorate in physical therapy from Mercy University in Dobbs Ferry, New York. And that was probably in 2010, I think, right? And I got a BS in exercise physiology from Rutgers University in 1994. And I'm a certified orthopedic clinical specialist, certified golf medical professional and golf fitness instructor, and also a level 1 certified CrossFit coach. And I'm also a certified dry needling specialist. So a lot of these things I've been using in over my 25 years of practice to help me make people feel better, right? Move better and play better. So let's admit some people in the waiting room, and I'm going to pull up my slides here. So let's make this session as interactive and helpful as possible. So if you have a specific issue that you got to talk about or have a question about, let me know. All right. So here's my slides. So understanding and managing tendonitis in athletes. All right, so let's make sure this thing works. Boom, nice. Now, because I'm a medical professional, I got to put this slide up. So this is not medical advice. This is not physical therapy. This is information that is very useful, but is aimed at a broad population. All right, so if you're dealing with something specific, you got an issue, consult a medical professional for a full physical exam. You get that physical exam, you get it treated properly. All right, so let's talk about tendons. Right, what's a tendon? Right, here we go. This is an example of a tendon. It's where your kneecap in the front part of your knee runs into the patellar tendon, right? That's an example. All right, another example. Oh, someone's in the waiting room. Pop that person in. Come on in, we're having a party. Or you're getting excited. This is another example of a tendon, right? It's the calf muscle, which is comprised of 2 muscles back there, if you didn't know, the gastrocnemius muscle, or the gastroc for short, and the soleus muscle. The gastrocnemius crosses the knee, the soleus muscle doesn't, but both of those insert into the Achilles tendon, all right? So ligaments versus tendons. You probably heard the term ligament. What's a ligament? What's a tendon? Rule of thumb is this: ligaments connect bone to bone, right? But tendons connect muscle to bone, and they're made up of collagen, this connective tissue, all right? Now, there's another piece of connective tissue that's called fascia, myofascia, whatever you want to call it. You could also call it paramecium or endomecium or epimecium. Fascia is this connective tissue that gives our body its shape, okay? Without fascia, our muscles would be just basically hamburger meat, just like unformed, right? Other theories of our body say that our muscles are in bags of fascia, and the tension or the movement of the muscle creates tension through the fascia, which in turn goes into the tendon. So I'm gonna pull this up and make this a little bit bigger. So the text is kind of small. So if you see this picture here, you have the bone on the left-hand side and the tendon, and then that's connected to the muscle. Now, if you look at the muscle itself, it's basically made up of these fibers. And these fibers of the muscle all run pretty much parallel to each other, right? They're all in one direction. And when that muscle fiber shortens or flexes, it creates tension through the muscle, and the fascia around it And that tension gets transmitted into the tendon. And that tendon, all those fibers in that tendon pull on the muscle, and that creates the movement. All right, the contraction, the force of the muscle precedes movement because it puts that tension through the tendon into the bone. All right, cool. You got that? Any questions about that? All right, so understand what that is. It's going to come up later because it's very important. All right, now the body is made up of this alternating pattern of segments. All right, this alternating pattern, this functional alternating sequence, that it's an alternating stability and mobility pattern. Okay, so if we understand and we just kind of summarize how we move and why problems come and why do you have a back pain or why do you have knee pain or whatever, just look at this slide here. That the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result. So you think about, for example, the common one that I'm dealing with right now, damn pickleball game I've been playing, is knee pain, right? So the knee is designed as a stable segment. All right, it's very happy bending and straightening. It does not like to be unstable or mobile. Now, why would the knee hurt? Well, if we look at the segments above and below that, we have to address those and make sure that they're doing their job. For example, the hip. The hip is the next segment above the knee that needs to be a mobile segment, and the segment below the knee is the ankle that needs to be mobile as well. Oftentimes, I find in a lot of my clients that do have knee pain, that their ankle or their hip is stiff. If it's limited with mobility, it turns into a stable segment. So because of that reversal of its role, this alternating pattern is disrupted. So what happens? Your body says, hey, I've got a tight ankle or a tight hip. I need to make up for that. I need to compensate around that. So what it does is it makes the knee unstable or a mobile segment. Does that make sense? So let me just hit that button there. All right, cool. Now, you probably heard these two terms, tendonitis versus tendinosis. Okay, if somebody says, hey, I got like golfer's elbow, it's still tendonitis in my knee, I got tendonitis in my elbow, but they've been dealing with it for like weeks or months, then it is not tendonitis. Okay, so tendonitis is basically acute inflammatory effect, right? That maybe lasts for about 72 hours. This chemical reaction, the environment around that tendon changes, and then we're replaced with tendinosis, which is a chronic condition. All right, so if you can't see those words, I'm going to pull that up. So tendonitis, inflammation. Inflammation happens in our body every day, right? It's how our body makes new tissue or breaks down old tissue, right? With overuse, that inflammatory effect can go unchecked, right? It goes haywire. And if that tendon or that tendonitis is not addressed, then it gets replaced with tendinosis, which happens, after the inflammation goes away. It's a chronic condition. We have these small tears you can see there, and they fail to heal properly. So essentially, these fibers of the tendon, which are supposed to be parallel to each other so that they match and are able to transmit the tension from the muscle through the tendon and into the bone, they can't because those fibers are not parallel to each other. There might be some disorganized pattern. I always use the analogy of a wrinkled linen shirt. Those fibers look ugly. They might get a little bit larger. They cannot transmit the tension very well. So every time you make that muscle fire or there's a little bit of pull or tension in that tendon, it hurts. Okay? So those are things that people come to see me. Usually tendonitis, you think, hey, you know what? I overdid something. I exceeded the tissue's ability to tolerate loading or speed or whatever, right? So if you say, I'm going to run a marathon in November, but then you haven't run anything and you go out for a 5-mile run, the next day you're going to have all this inflammation. All these tendons are like, oh my God, what are you doing to me? they've exceeded their tolerance because they haven't done it, and then we have tendonitis. If we don't stretch or have good recovery, then it turns into tendinosis, which can cause pain, and then it's harder to get rid of. All right. So how do we get rid of it, or what's the prevention? What's the treatment, right? So prevention, if we think about that alternating pattern of stability and mobility, that's one thing. That's our baseline. That's our non-negotiable. Those segments of our body need to function the way that they're designed to. Because if you're going to go out and play sport or do something and you have a dysfunction in that alternating pattern, then you're just like trying to race your car with a spare donut tire on it. It's not going to work. Something's going to happen. So we prioritize body mechanics. Body mechanics, moving properly, making sure that our joints move in the right direction and position when we're loading the body so that the tendon and the muscles can do their job. Oftentimes we talk about the knee. If the knee turns into that unstable segment, right? We'll talk about it a little bit more in a moment. Then the angle of pull of those muscles can create an imbalance or an asymmetry around the tendon, which then can cause increased tension or overuse of that tendon, and then the whole process happens, right? So we want to be able to stretch, right? Be able to restore normal physiological tissue elasticity. That thing needs to stretch and it needs to shorten. You got to do it properly, right? The other thing is hydration. You know, being able to keep our tissues hydrated so that we have good circulation and good recovery, right? Which also includes sleep. Those are also non-negotiable. The amount of water that you should intake in your body per day, rule of thumb, is half of your body weight in ounces. So for a 200-pound man, you need to drink 100 ounces of water per day. And sleep 6 to 8 hours, right? So we all know that, right? We need to have good quality sleep because sleep is our body's time to recover from what you did during the day. All right, so those are things that you got to think about to prevent tendonitis or tendinosis from occurring, or definitely prevent tendinosis from progressing. And we want to be able to reverse that tendinosis. And if you are dealing with some tendon issues, how do we do that? Treatment, right? We talked about circulation. Increasing circulation is one of the key things. Blood flow is key, all right? In the environment, typically in the muscle and the tendon, after a overuse injury or whatever, the environment, the tissue becomes more acidic. And that acidic environment reduces the ability for all those ions and those chemicals to do their job to recover, all right? So that's one. Number two, CFM, IA, STM. You've probably seen this as cross-friction massage. We'll talk about that a little bit more. And IA-STM is instrument-assisted soft tissue mobilization. So if you're going to a medical professional, chiropractor, physical therapist, athletic trainer, these are some things that you might encounter. Cross-friction massage and instrument-assisted soft tissue mobilization. The other thing is dry needling. Dry needling is another technique using solid filament needles, very thin, thinner than your hair, and inserting it into trigger points or tendons to help rehab that process. Again, shockwave therapy. All right, so that's sending a sound wave with a mechanical device or with a device sending sound waves to mechanically vibrate or break up scar tissue. You think about like cross-friction massage, IA, STM, all of that, and dry needling and shockwave, etc. All of that is different ways to restart your body's inflammatory process. All right, so healing the body to make tendons stronger, we need to irritate them a little bit. Just like with weightlifting or exercising, right? That exercise, you lift heavier and heavier weights, creating trauma and stress on the muscle. And the next 24 to 48 hours, your body has to grow more muscle or recruit more muscle units, and your nervous system adapts. So there's adaptation to the stress that you put on it. So all this stuff so far, we're creating irritation so that your body can adapt. That tendon can get stronger. And then we have eccentric strengthening exercises, which are the key to building tendon durability. All right, so what does all that mean? Let me pull this up and we'll talk a little bit more face-to-face right here in my camera. So cross-friction massage, right? So let's talk about that. Cross-friction massage. If we think, for example, my knee, my thigh, this is my quadricep muscle, the kneecap is the patella, and below the patella is that patellar tendon. We talked about that. You saw that in the video, the picture, the first picture I threw up there. So essentially, the fibers of the muscle and tendon run up. They usually, in the body, these tendon fibers run parallel to the long bones of the body, right? So you got that. So that little piece. If the tendon is irritated, and we have tendinosis, those fibers that are going up and down, cross-friction massage is basically putting pressure and manipulating that soft tissue sideways. So you can use your hand, use your thumb, use a metal instrument here. We'll use that in a second. Use a ball, cross ball, hard thing, doesn't matter. We're going to take our thumb, and it has to be whatever, very hard, and we're moving across those fibers. And you think about like if there's adhesions or chronic tears in there, you want to break up that scar tissue to, again, restart your body's inflammatory process so that we can rehab that tendon. So I got a couple things here. These are metal instruments and stainless steel stuff. There's a lot of different companies that make products like this, similar, and you can even buy them on Amazon. I mean, I've had clients come in, and recommended utensils for them to use at home so that they can do their own cross-friction massage when these problems come up, all right? So they essentially have like different shapes to fit different body parts, and the edges are beveled, but I could use that metal instrument to do the same thing that I did with my thumb. Okay, so I'm going to use this edge here, and I'm going to move that across the fibers. And if you Google cross-friction massage, you could probably see a lot of videos of this, so you could see how this instrument here has this beveled edge, a little bit fatter one, and two pointier, smaller ones here that we can go right across the fibers to massage those areas. And the other ones that I mentioned earlier were dry needling and shockwave. I don't have a shockwave machine here. It looks like an ultrasound machine, but in dry needling, sometimes these treatments, whatever you select, may be uncomfortable. All right, but the discomfort that you feel with the treatment should never exceed a sharp or stabby pain, or maybe 7 or 8 out of 10, right? So it might be uncomfortable, but the discomfort that you get with these treatments should go away immediately when we stop, okay? And then after we do that, we do whatever we do manually, then the next step to rehab this tendon, to make the tendon stronger, is eccentric strengthening. I usually start with isometrics first. Isometrics is basically creating tension in a muscle, contracting it without movement. So for example, if I'm here and I get into a squat position and I'm holding that is an isometric contraction. I'm contracting my thighs here, contracting that patellar tendon, and I'm going to hold it. Maybe about a minute or so. You want to hold it for a minute? Great, that's an isometric. Now the eccentric is when we really load the tendon and it's under tension and as it lengthens, okay? So here's an example for the patellar tendon. The concentric contraction would be when it shortens under tension. If this shortens, I stand up. That's the lift. That's the concentric phase. And then the eccentric phase is a lowering, when I'm lowering my body. So here it is again. I contract, it shortens, the muscle flexes, and then I stand up. So I'm lifting the weight, which is my body in this case. And I could add extra weight if I want, dumbbells, whatever. And then lowering, I'm lowering, and then that tendon, that muscle is lengthening, but it's lengthening in a slow manner and controlled so I don't plop down. Now, you could always lower more weight than you can lift. So I always recommend that we need to overload the eccentric with more weight that you wouldn't normally lift on your own up. So quick and easy way is I just stood up using both legs. If I shift my weight to my left leg, I've got 80 to 90% of weight over here. I'm going to sit down on the chair, again, generating that tension and lengthening. This is the eccentric phase. Much more difficult if I did this up with one leg, but I'm lowering with one leg. And I want that tension to be as long as possible, pain-free and controlled. Maybe 6 to 8 seconds on the way down. Then I could use both legs and stand up, and I repeat that. And usually, there's certain protocols that say, 8 to 10 repetitions, maybe 4 to 5 sets. But, starting out, if you do like a good slow eccentric where you're really under tension for a prolonged amount of time, maybe just try 5 and see how it feels, right? Again, a lot of these interventions, they should not create lingering symptoms afterwards. All right. So let's see. Oh, look, they got a question in our little text box here. Let me take a look. So how do I search these on Amazon? Right. So we pulled up those things. I'm going to say instrument-assisted soft tissue mobilization, right? So it's IASTM, right? IAS. Oh, we got a latecomer coming into the room. All right, cool. Come on in. Anyway, metal instruments. You could also look for like scrapers or whatever, muscle scrapers. I will say this, one caveat. When you go search for those things, good quality stuff is more expensive than poor quality stuff. Sometimes they're made out of plastic, right? Or thin metal. Otherwise, they're stainless steel and they're a little thicker. So you want the ones that are double beveled, right? So if you think about the edge of that metal has double bevel versus a single bevel, versus one side is straight and the other side is kind of beveled. Single beveled instruments tend to be a little bit more aggressive, feel like a little sharper, as well as instruments that are thinner, that are made of thinner metal, and then they tend to feel like it's sharp. I picked the ones that I use because they're made by Rock Tape. If you look up Rock Tape, the Rock Blade, right? Rock Blade, that's their signature word. Rock Tape, Rock Blades. They're the thickest ones that I've seen. And the double beveled edge makes it very comfortable for anyone to use this on their own. All right, so hopefully that answered your question. All right, so I'm going to wrap things up. We've got people in the class here. If you have any questions, type them in now. I'm going to give you a 30-second countdown. If not, we're going to close it out today so you can enjoy your sunny Tuesday wherever you are. All right. Okay. All right. Sounds good. So thank you, everybody, for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. I've been doing this for like, I don't know, 2 years. I've got a lot of classes on there. So if you like what I'm talking about today, you can go in there and look for the on-demand stuff. So I will be back Tuesday, April 8th. We're going to be talking about golf mobility, unlocking your hips and spine for a more powerful swing. If you lack mobility in your hips, thoracic spine, or your shoulders, that can cause lower back pain and limit swing efficiency. Remember, the alternating pattern of stability and mobility. We're going to revisit that again. So in the next session, we're going to learn about how to improve the flexibility and mobility in these segments to create a smoother, pain-free golf swing. All right. Any questions, you could email me here at paul@par5pt.com or team@betterspaces.com. All right. Thank you for coming and be well.